Well, welcome to CommQuest Services Community Conversation. I'm Keith Hochadel, President and CEO of CommQuest Services, and I can't even begin to tell you how grateful we are to be joined today by the Honorable Judge Forchione from Stark County Common Pleas Court. Thank you so much for joining us today, Judge.
Thank you, and it's an honor to be with you with all that you do at CommQuest.
Yeah, I appreciate you. You're a busy guy as well, so I think we're all working in a great community.
We are. We're lucky.
Yep. Hey, so, we do these conversations just to kind of let the community know a little bit about different parts of the community. So, because you and I have been kind of kindred spirits in this whole opiate stuff, thought it'd be a good idea to have you kind of sit down today. So can you tell me a little bit about your journey and how you made your way to the bench?
Sure. I'm a kid from Canton. I grew up not too far from downtown. Actually spent a lot of time at the CYC, which was this building. I lived by Gibbs School and went to Kent State and was the last person I think that got into Akron Law School. They called me like the week before I was on a waiting list. And I'm the only one that wanted to come back home. And I wanted to come back home to Canton. I worked in the prosecutor's office and was a city prosecutor for about 12 years. And decided I thought maybe more of an impact as a judge. Put my name on the ballot. I put the name Francis. I have 5 lovely sisters, and I think everyone thought they were voting for one of my sisters. And somehow I got elected, so that's where I'm here.
That's outstanding. That's outstanding. So talk a little bit about Common Pleas Court's role in the community.
Yeah, that's a great question because I don't think people understand. We handle the most serious felony cases, murders, rapes, and things of that nature, and also civil cases, medical malpractice, automobile accidents. But what I don't think people realize is the impact we have on treatment and the drug culture and things of that nature. That's a big part of our docket and a big part of our concerns.
Yep. And how has the court had to change some of the things around the COVID pandemic?
Well, for me, it's had a big impact because when I sentence people, we have a treatment facility, the Stark County Treatment Center out at the Stark County Jail. I go out once a month and visit them and talk to them. I've not been able to go out and do that. And it's always nice in the courtroom when I say, not only am I going to sentence you there to the Community Correction Center, but I'm going to come visit you and see you. And it shocks them when you go out there.
Yep.
As for jury trials, we've had to do them differently. We're picking jury trials out at the Cultural Center, picking the jury, and then bring them into the courtroom where we have plexiglass. The drug court, which Judge Farmer does a great job, it's a little harder because you're doing it by Zoom, and you're not having that face-to-face interaction. So it is given us some difficulty, but we're not stopping and we're not quitting.
Right. And I think that once you guys got back and had the courtroom all kind of reset for protection, it looks like just running a regular set of trials, it sounds
like. Since there was a tolling period from March till the end of July. Since August, I myself have done 9 jury trials. The jurors have been incredible. We send our notice out to them and say if they have any COVID concerns, let us know, and we let them out. But it's been very effectively, and I think we've probably more effective than most of the counties in the state of Ohio. And it's a joint effort with everybody.
Sure. So you talked a little bit as part of this part of the discussion about those impacted by substance abuse and mental health. So one of the things that I think that sometimes people don't realize is when they start using, nobody begins to use thinking they're going to be an addict or dependent upon anything. Nobody ignores their mental health symptoms because they think it's going to turn into behavior that's horrible. Can you talk about some of the people that you've had in front of you and just kind of the journey they've taken from trying something out or ignoring their mental health symptoms to where they get in front of you?
Yeah, there's a perception by a lot of the community, and it's changing a little, because we've all been touched by this, that, if you're using opioids or you get addicted, you're a bad person. There are a lot of good people from great families. And a lot of times it comes from people in automobile accidents, athletic injuries, and things of that nature where they start to take this medication. They rely on it. Maybe they get cut off or the prescription ends, and it's the only way that they can deal with the crisis. And so these are people that we can save. Locking them up and throwing away a key isn't going to cure the problem. And I think it took a while for the public to realize that. I can tell you by the negative feedback that I got by trying to cure the problem like you are.
Right.
But now about everybody's life's been touched by it.
Oh yeah, yeah. And how about on the mental health side? I'm sure you see a lot of folks that have committed crimes because of untreated mental health.
You know, Judge Reinbold, who's a mentor of mine, and I got asked to speak somewhere, and someone said, what do you think is the biggest thing in the criminal justice system people don't understand? And we both said mental health. We don't realize that I would say probably 30% of the crimes that come in front of me, I can tell that they have mental deficiencies. You know, we have a lot of poverty, which also prevents that. And it's not a popular cause, I think, for politicians to say, hey, I want to get more money to treat mental health for some reason.
That's for sure.
And so I think it's probably the biggest problem in the criminal justice system in that we're not addressing it properly. Now, we have in the Common Police Court have tried to do it through our HOPE program.
Yep.
And that's something that I think has been very effective, where we try to get people right off the bat. We share their records. We try to get them into the right facility. I don't think people have any idea all the different things that CommQuest does for mental health, not just alcohol or drugs. They treat people who are rape victims.
Yeah.
All mental health issues.
Yep.
I just wish everybody understood that.
Well, and I think that, you know, it's hard enough to acknowledge that you have a problem. I know when I went through my own early part of my recovery, it's like a first AA meeting I walked into, they said, we've been waiting for you. So they saw something before I knew myself.
Right.
And I think it takes a lot of courage for people to step forth, but I don't think they realize sometimes how many services, not only CommQuest does, but our county has a plethora of services available for people, and that there should be no guilt or shame in having the courage to step up and ask for help.
Absolutely. I think some of the most courageous people are the people that have been in my courtroom that are trying to get better. It does take some wherewithal inside to want to get better. But the facilities are out there, the treatment is out there, but these people are fighting a daily battle within their soul.
Sure. Yep.
And it takes a lot of courage to do that.
And Judge, it's in a lot of ways, it's easier today to get service than it ever has been before because the availability of virtual health. I mean, we can take calls from people that want to have an assessment and want to have individual counseling and even some group stuff. And all they have to do is call, and we can do a video session we're allowed to do telephone sessions, at least the starting point. So we can build that relationship, much like you've built relationships with people that have been in your court and, you know, that are doing okay.
Yeah, there was a stigma, I think 4 or 5 years ago, well, I want to get help, but I can't get in, or they told me to come back in 5 days. And when I hear that, I say, no, call me. Call CommQuest first.
Yeah.
But if that doesn't work, call me, because you will get hope right away through one of these facilities.
Yeah.
I think people are starting to see that.
Yep.
And I think the stigma of just acknowledging that we have this issue and we have to deal with it has become front. Look at obituaries anymore. There are several people. That takes real courage to put in an obituary that my son or daughter overdosed.
Yep.
Those are courageous people who I admire. So I think word is getting out that you can get that treatment immediately. I know everywhere I go, I speak and put the names and numbers up there. I think it's getting better, but not perfect.
Yeah. I know that you know, throughout the year, there's a number of times I'll get a direct call from you or somebody else that just says, "Hey, look, I got somebody. How do they get in?" Just have them walk into Market Avenue or Cleveland Avenue or Maslin or Reliance anytime, and we'll take care of that. So I know you have a tremendous passion to assist those folks with opiate issues. So much so that you founded the Stop Heroin from Killing Committee.
Yeah.
You know, I know that you go over to Stark Regional Community Correction Center and meet with people, and you've been to our facilities as well, and you have an awesome symposium that I've been blessed to be able to speak at and participate. Can you talk about where you kind of see solutions and some of the barriers that still exist?
I learned the biggest barrier, I think, is by going out to the SRCCC and speaking to the ladies who said, you know, Judge, these programs are great. But what happens to us is when we get out, we've lied to our families, stole from our families, probably our employers. Our friends won't talk to us. Where do we go? So we have a great need for transitional housing.
Yeah.
And I've read that the 4 biggest pharmaceutical companies have settled for $26 billion, which it sounds like a lot. I don't think it's enough. But when we get our share in Stark County, one of the things I want to push on is more transitional housing so that if we can cure the drug treatment, get them in a period where they can filter back in society. that's kind of what I personally see would be a great thing.
Yep. Well, and I think, education and work and family system repair is all going to be part of that.
Sure.
And not continuing to put people back in neighborhoods where they have a less likely chance to succeed.
Yeah, the problem is, where do you go for support? I'm very fortunate with my family that we're a very supportive family. A lot of people don't have supportive families,
Right.
or have family, or burn bridges. So there's a lot of help through CommQuest and some agencies. I just think with the transitional,
Yep.
that would be helpful if we could do more.
Oh yeah, well, and then they have a group of peers that can support them,
Right.
along with bringing in additional services, assisting them in getting jobs and that as well. So I think that would be a tremendous use for the opiate settlement dollars.
Yeah, I'm hoping this works out and we get our share of funds.
I hope we get more than our share.
Yes, that'd be great.
And I start wondering, should families that have lost and have invested considerable amount of dollars in getting their kids and sons and daughters and wives and husbands, should they receive some of that as well?
Yeah, that's going to be interesting to see how it plays out. I'm hoping that Santa, when he climbs down the chimney, although I don't know if he can climb through chimneys this year,
Yeah,
but he's got a big chunk for Stark County.
Yeah,
That's what I'm hoping for.
I do too, and we'll keep advocating for that.
Sure.
So in our community today, we've been impacted by COVID and social unrest and political issues and all of that, and I'm really hopeful during this time of year that people seek out gratitude and hope. And I know
Sure.
you've had a number of success stories that come
Yes.
through your court, and just as we're closing, besides the good news we have from the Browns, I just wonder if you might be able to share a couple positive stories of
Yeah.
some folks that have come through and had success.
2 short ones, and I'll try to make them short. One of the first gentlemen, Jack Hoover, came into my office. I don't know if you know Jack, or in my courtroom, and having a lot of issues. And he was at the lowest part of his life, he told me. He told me in court. He said, everyone's given up on him, he's given up on himself. And I, who's been through a brain tumor and cancer, said, when I get that way, I always put on the 15th round of Rocky. You got to watch Rocky because he always gets up.
Yep.
And whenever I'm down, that's what I put on. So I sent him the CD of it. He's watched it, and now he's been clean for, I think, 4 or 5 years. He's spoken at our seminars. The other one is Sarah Alton, who hated my guts, like most of the people in my courtroom. She now has Serendipity Bakery, but she was pregnant. We had a battle. I sent her to prison. And then she came back to see me in my office one day and told me she had been clean. And so I hired her to bake a cake for my wife, which was amazing. And this year she called my wife, and on my birthday, my wife took me down here to Luca downtown for the restaurant. She surprised and brought a cake.
Oh,
And she had heard we were going to New York, but we canceled our trip with the virus, and it was a New York-themed cake.
that's
So
awesome.
these are just 2 success stories. We lose some, we have some in the middle, and then we have some real successful. And it's just incredible, the relationships I've built with them. We still email or talk on the phone every now and then, and that's a great thing.
Yeah, I think that the best part of what we do
Yeah.
is the hope that people have when they have an opportunity to get clean and sober or find recovery from their mental health stuff,
Right.
and we get to see that success.
Yeah.
That's just so cool.
I tell people in my courtroom, when you get your act together, call me and we'll go to lunch. And believe it or not, I'll get 3 or 4 calls a year. And I'll say, okay, let's come on down, we'll go to lunch and see how you're doing. So we're trying in every creative way, as I know you are,
Yep.
to try to make an impact.
And we do, and you are making an impact.
Thank you,
So,
we're trying.
Judge, I want to thank you for joining me today on CommQuest Community Conversation. I hope that you and your wife and family have a tremendous Christmas, and that 2021 is outstanding for all of us.
Me too, and I have one word to say.
Yeah.
Playoffs.
That's
Playoffs
right.
for the
Playoffs it is.
Browns. Thank you.
Thanks, Judge. I appreciate it.